Stages of atherosclerosis. We knew that coronary artery disease is a progressive disease that takes many years to develop. When it becomes symptomatic, the disease process usually well advanced. In the stage of development of atherosclerosis, there are mainly three stages: fatty streak, fibrous plaque, and complicated lesion. In the fatty streak, it is the earliest lesion of the atherosclerosis, and it is characterized by lipid-filled smooth muscle cells. As the streaks of fat develop within the smooth muscle cells, a yellow tinge appears. A fatty streak can be observed in the coronary artery by the age of 50, and it is increasing with the age. And it is generally believed that when we are treating this with a lipid lowering agent, usually this can be reversed. Fatty streak can be reversed. So fatty streak is nothing but it is the lipid filled smooth muscle cells. And due to the filling of this lipid, it become yellowish color. So that is regarding the fatty streak. Next is the fibrous plaque. So in the fibrous plaque, it is the beginning of progressive changes in the endothelium of the arterial wall. So here in the endothelial layer of arterial wall progressively changed. And this process start at the age of 30, and this also increasing with the age. Normally, we knew that the layers of artery can replace itself. Any problems that occurs in the arterial wall, it will be replaced or repairs by itself. But in case of coronary artery disease, there are lot of risk factors that prevents the repair. So we knew that there are modifiable risk factors and non-modifiable risk factors for the coronary artery disease. And hypertension, tobacco use, hyperlipidemia, diabetes, infections, immune reactions, all these are the risk factors of coronary artery disease that cause LDL and growth factors from platelets to stimulate smooth muscle proliferation and thickening of the arterial wall. Once the endothelial injuries occurred, lipoproteins transport cholesterol and other lipids into the arterial intima. So when the internal layer or endothelial layer of the arterial wall is injured, all the protein, the lipoproteins, cholesterol, everything will be accumulated in that area, and that leads to collagen formation and fibrous plaque formation. And usually the color of this fibrous plaque will be whitish or grayish in color, and the edges will be irregular, and rough and jagged edges will be present in fibrous plaque. And when it grows further, what happens is the blood flow will be decreased to the distant areas. So that is fibrous plaque, and it is highly risk area, fibrous plaque formation. Next one, complicated lesion. Complicated lesion means it is the final stage of development of atherosclerotic lesion, and it is very dangerous. As a fibrous plaque grows, continued inflammation can resulting in plaque instability, ulceration and rupture. Once the integrity of the artery inner wall has become compromised, platelet accumulate in large numbers and leading to thrombus. The thrombus may adhere to the wall of the artery, leading to further narrowing or total occlusion of the artery, and activation of exposed platelets that cause expression of glycoprotein that binds fibrinogen. This in turn leads to further platelet aggregation and addition, and then that leads to enlargement of thrombus. So in complicated lesion, what happens is, when there is fibrous plaque grows, that there is chance to rupture. So when it is rupture, what happens is, there will be platelet aggregation, and that leads to a large thrombus formation that blocks the coronary artery. So that's why the appearance of this complicated lesion usually red in color, and the collagen fiber that appear as a blue. So in complicated lesion, usually there will be total occlusion of the artery. In this stage, you can see that there is borderline, that is fatty streak, and high risk area, that is fibrofatty plaque or fibrous plaque. Then very dangerous situation, that is complicated plaque. In fatty streak, there is no restriction in blood flow. But in case of fibrous plaque formation, here there is a restriction in blood flow. Partially, it will be, the blood supply will be partially blocked in fibrous plaque formation. But in case of complicated lesion, or the, if the plaque is ruptures, there will be total occlusion of blood supply. Okay, so that is regarding the stages of atherosclerosis. Atherosclerosis, the stages are fatty streak. Here there will be yellow color and the accumulation of lipid cells. Second stage, there will be endothelial injury that leads to collagen fiber formation, and that leads to the irregular edges of the arterial wall. And third stage is complicated lesion, or the, when the plaque ruptures, there will be a thrombus, large thrombus formation will be occurs that occlude the blood flow. So that is regarding the stages of atherosclerosis. Thank you.